Good evening, everyone. I'm Darrell Steinberg, your mayor, and I want to welcome you to another edition of our Facebook Live. I want to again thank the Sacramento Bee for hosting this event and putting this on their Facebook page. Tonight, I want to talk at some length about the most important question on people's minds, and that is, when can I return to my life? When can I return to work? When can my business open? Before I get into that discussion, though, I think it is important that we reflect a little bit and report on where we are on the health side. Because when it comes to the spread of the coronavirus in Sacramento, we are still looking very good. The key indicators that the governor talks about every day in terms of hospitalizations, ICU placements, and deaths continue to be very hopeful. For example, on April the 3rd, we had 77 people hospitalized in Sacramento County, and today 46. That's obviously a downward trend. 28 people in the ICU as of April 3rd. Today we have 16. 42 people have died, and of course, every life matters, and every death is a tragedy for the person, obviously, but also for their family and their friends. But it's also true that when we compare where we're at with other parts of the country, we have one of the lowest per capita death rates from coronavirus in the entire country. And it is hard, I recognize, to celebrate a negative. How many people would have died if we had not been one of the earliest counties and the earliest states to practice the physical distancing? How many more people would be in the ICU? How many more people would be in the hospital? And how many more people would be sick? We should take some rightful pride in the fact that the expectation in terms of the number of people who would get sick and die and the so-called surge, the overcrowding of our hospitals has not materialized. A parent told me today that for their kids, the first few weeks of this for the kids was kind of fun. It was kind of an adventure. And he told me now that we're 6 weeks in or so, even for the kids, it's not fun anymore. The kids want to go back to school. Well, none of this in the first weeks or now has been fun for adults, and exactly the opposite for people who have lost jobs, who have lost businesses, who have been furloughed or have had their hours reduced. None of this has been fun. And yet I think it's important today that we recognize that while the first weeks were dominated, and rightfully so, by the medical statistics, the conversation about flattening the curve, today in California and in Sacramento, the overall debate and conversation is changing rapidly. The question I asked at the very beginning is the question that is being asked rightfully everywhere. When are we going to reopen? People are understandably anxious, especially those who are struggling to make ends meet. Recognize that May 1st is right around the corner. That's when mortgages are due. That's when rent is due for residents, also for business owners. And so rightfully, the discussion, especially since we've been so successful in flattening the curve, people want to know, well, why not now? I had a conversation today with one of the business leaders in South Sacramento who told me a story which I'm sure is typical. He talked about one particular large small business corridor along Stockton Boulevard with about 70 businesses and small businesses, from hair salons to nail salons to small hardware stores. And he said that people are getting desperate and that there's a lot of conversation about the heck with the order. We are going to go ahead and open our business because we cannot survive. And so it's important that you understand that those public officials, whether or not we have any authority over the public health decisions, are very, very sensitive and concerned about the same things. A couple of thoughts. The events again are moving very fast. Yesterday, the governor provided significant detail and talked about a time frame without a specific date, about a couple of weeks to begin moving from what we're now in phase 1 to phase 2, where the state and all of its cities and counties begin relaxing our stay-at-home orders so that more businesses and more public facilities can be open once again. The work from the first weeks, the work in the first weeks was centered on the question of what is an essential business. And so the line was drawn in a way that said, in those first weeks, obviously, if you're a healthcare worker, if you are providing groceries by working in a food service place, if you are working in any kind of an essential business, essential to the public health and safety, that you could work. And everyone else, if you weren't essential, you have to stay at home. We encourage businesses to allow telecommuting, and people have telecommuted in massive numbers here in California and in Sacramento. Well, here is where the conversation is really shifting, and I hope that people take some note of this with some hope. We're going now from what is essential to what is safe. So over the next couple of weeks, the effort is going to be made to open some non-essential businesses so long as the industry or the business can practice, not just practice, but actually do the physical distancing that is necessary to ensure that people are safe. The governor, in his comments yesterday, talked about bringing back some retail, especially where people can pick up whatever good they are buying at the curbside. He talked about opening manufacturing again. Construction in Sacramento County, construction has been allowed. In some other parts of the state, it hasn't. The Bay Area lifted their ban on construction, I believe, today, but that will now soon become a statewide relaxation of the pre-existing order. Childcare facilities. The governor even talked about potentially opening schools in July, earlier than September, because he recognizes, as we all do, that kids can't go 6 months without being at school. Even as good as some of the distance learning efforts have been and continue to be, we all recognize that it's no substitute for actually going to school. And so we're not waiting, and the governor is not waiting, and the county health officials are not waiting for everything to be perfect or for everything to be fixed. In the next couple of weeks, we're going to increase our testing capacity in Sacramento County, upwards of 25,000 new tests, where we'll be able to test people in so-called congregate facilities. We're already testing the homeless in our shelters. And maybe as importantly, we're going to be able to set up remote testing sites in some of the neighborhoods of Sacramento. And I'm very sensitive. I know that the county health officers are very sensitive about ensuring that some of those testing sites, when we have the supplies, are in some of our communities of color, because we want to make sure that we are always cognizant of, sensitive to, and addressing the fact that this illness and its economic impacts are disproportionately impacting some of our traditionally disadvantaged communities. So the stay-at-home orders, both from the county side and from the state side, will be relaxed when and if. And let me begin with the when. Again, the governor talked yesterday about retail, manufacturing, childcare, and potentially opening schools earlier. That's going to be dependent on us meeting some of these testing benchmarks, both at the statewide level and at the county level, and also receiving the promised additional personal protective equipment so that in these settings, people can wear the appropriate masks and gloves and whatever else is necessary to ensure that with physical distancing, that they're not likely to spread the virus if they have it. The harder one is gyms, hair salons, nail salons, places of worship. These are all very important businesses and parts of our daily lives in Sacramento that are not in that next phase that the governor described yesterday. They're in a phase below. And so I can't tell you, and I can be nothing but honest and transparent with you, that bringing back those businesses and places of worship is around the corner, or that's a couple of weeks away, because it is more difficult. It is more difficult because of the physical closeness that are inherent in those businesses and in places of worship. To be able to say, if you go back now without even more testing and even more personal protective equipment, that it's going to be safe to do so. I don't make the public health decisions, but we are working daily with other mayors, with the governor's office, and with our health officers, both locally and throughout the state. Everybody wants to move up the timelines, including me. Everybody who's in any position of responsibility wants to move up these timelines. As I said, we are adding to our testing capacity in Sacramento County. We are pushing hard for more personal protective equipment and are increasing our inventory. I'll have an announcement about a very generous donation of personal protective equipment this Friday. I personally, as one elected official, only one, and again, the city does not have the ultimate authority over the public health decisions. I want to tell you where I stand. I will continue to push for as early a reopening as possible on all fronts. I will question the public health experts because they are public officials, just as you have the right, and in fact do question me and other people who are elected to public office. In the end, I will follow the judgment of the public health officials. And if it's a close call, I will err on their side when weighing the balance. This is now moving in a better direction in terms of opening the economy. And again, just to reiterate, the discussion and the decisions and the line drawing in the early weeks was appropriately what is essential and what is not. We are now moving to considering those things that are not essential in terms of public health and safety, but certainly are essential to people being able to make a living, to be able to run a business, to be able to enjoy life. And so now those ranges of activities around reopening the economy are now being considered. And in a phased way, we can bring back what we are all desperately missing and what people are depending upon in order to be able to pay their bills. But it's going to be phased. It is not going to be fast enough. And we're just going to have to do the very, very best that we can. And here is the if. I said there was the when, and there is an if. Here's the if. If we are irresponsible, and if we don't continue to practice the physical distancing, if we open up everything and the infections spike and rise, if we don't calibrate this in an appropriate way, then the stay-at-home order will not be relaxed. It'll be tightened, and it'll be tightened for a much longer period of time than the time frame that we are dealing with today. Not perfect, far from it, but I just want to give you the best of my thinking and some information that I hope you find hopeful. Some hopeful news. Let's shift for a moment. So Zoom and StreamYard and all these new technologies are new to me, and I'm sure they're new to many people. But think about this. What has not yet been invented when it comes to how we respond to crises, how we respond to the coronavirus? And so our Chief Technology Officer, Lewis Stewart, brought me a very interesting initiative, which I want to announce tonight. There are many other technologies undoubtedly out there around public health, around public safety, and other challenges during the coronavirus pandemic. Sacramento is going to take the lead. We are creating a new portal and inviting anyone with a new idea, a new technology upgrade, any new equipment, safety equipment idea to come forward. And we will work with the Carlson Center at Sacramento State University. We will vet the proposals, and I will recommend for seed funding any proposals which would help advance how we can respond to this kind of crisis or any kind of similar crisis. And here's one just to throw out that I've been asking about, especially as we think about how to achieve this delicate balance of safety and returning the economy to some form of stability. Is there nothing between an N95 mask and a cloth mask? And I know the answer is yes to that question, but I ask it more rhetorically. Is there not some technology or equipment out there that would enable us to get back together with the intent to maintain physical distancing, but even allow us to protect more people in the workplace, even if they are not able to physically distance at all times of their workday? Just a thought. There's got to be something in addition to physical distancing that's stronger than a cloth mask, that isn't an N95 mask, that would provide that extra layer of protection and allow us to get back sooner than not. Let me talk for a moment about the issue of homelessness, because that's another one that is very, very important to us. I'm pleased to say, and I've been the most impatient of people and leaders when it comes to asking, all right, the city and county have laid a great foundation here in terms of this Project Room Key and the trailers at Cal Expo. We've got 990 rooms. And if we can get 990 people in, actually more than 990, because some family units and couples can go into the trailers and even the rooms. If we can get over 1,000 people in, and we can then, under the COVID context, and then work to rapidly rehouse them, by the end of this crisis, we will have gotten 1,000 or more people off the streets. And I said the other night on my Facebook Live with Lisa Bates, who's doing a great job as the director of our continuum of care, to me, there is absolutely no reason that by the end of this, we should not have filled up every single one of those rooms. And so I'm pleased to tell you that, in my opinion, the pace is picking up. It really is. They have changed the criteria. I've been pushing that to focus even more on people who are not COVID positive, who are not symptomatic, but who have fragile health conditions, regardless of age. Because one, they're more likely to get or pass on the virus, but two, their health is jeopardized with or without the COVID crisis, and we want to get them indoors. And so I know that the county, again, working with the city, has now leased a second motel. They are beginning to fill up that second motel. I'm sure that the third and fourth motel are going to be quick to follow. And so this is picking up speed, and there's a lot of need out there. In addition to the fact that we're feeding, a couple hundred people a day in the tent encampments and bringing them additional sanitation supplies and doing more than the city and county together have ever been able to do. Long way to go. But the foundation is there. And this week, I'm beginning to see an uptick in terms of the numbers. We're now in the hundreds, multiple hundreds. And we know we need to go higher, and we will. The federal stimulus package, just a brief update. The City Council is going to hold a workshop this month on the $89 million stimulus that we received from the federal government. And as you know, that money cannot be used to fill budget holes. Fortunately, we have that Measure U, that full cent that, while it wasn't originally intended, actually is a ballast to ensure that we do not have to lay people off or make any dramatic cuts or serious cuts at this point anyways to our essential city services. So I want that 89 million to be used on economic recovery and economic investment, especially in our disadvantaged neighborhoods. And so I don't make this decision alone. My city council does, with the input of the community. And so we're going to workshop. We're going to hear all the ideas from my colleagues. I'm going to put out a framework that I hope will guide the discussion over the next couple of days. And this is a tremendous opportunity for us to catalyze the economic recovery, to get back as close to where we were before this started in terms of the momentum that we have in Sacramento around making Sacramento a destination amenity, around affordable housing, around investing in our commercial corridors throughout the entire city, investing in our young people and the creative economy. We're going to be very smart and strategic about this. And so another sign of hope. One area where I really believe Sacramento has led the rest of the state has been the amazing way that our restaurants have quickly converted their kitchens to serve people who need food. A half dozen of our downtown restaurants started very early. They've been feeding hundreds of seniors, and the city has provided a grant through our Justice for Neighbors program. I want to thank our city attorney and the city attorney's office for helping to spearhead that. Paratransit, which is the transit agency for people with disabilities, have repurposed their buses because they're not taking as many trips. They're delivering meals to low-income seniors. We have gotten a lot of money to the food bank, which has done a heroic job. And we're able to provide 6 weeks of additional food for 1,380 families in the City Unified School District who are struggling because they've lost jobs or have been furloughed. Tomorrow, we are set to announce a partnership with Sacramento State to feed hundreds of students who don't have a reliable way to get food with the dining facilities closed. And this includes a lot of DACA students, a lot of young people who are our kids and who matter every bit as much. And they're not as eligible for other kind of public aid. And so we are rallying again with a $20,000 grant through our Justice for Neighbors program in the city attorney's office to be able to provide food to hundreds of students at Sacramento State. I look forward to that event tomorrow with President Robert Nelson. And then we are going to launch a big one in collaboration with the state and our federal partners. We're going to call it Meals for the Moment. This is the program that the governor alluded to last week. FEMA and the state are paying for nearly 95% of the cost of the program, which will pay our local restaurants to make meals that will be delivered again to seniors. The more seniors who sign up, the more restaurants we can help. So if you're a senior and you don't have access to enough food, and don't be shy about it, we want to help you. Please call 211 today to sign up. If you're a restaurant owner and you want to participate, please go to my website, engagesac.org, and sign up by Friday. We've already had dozens of restaurants sign up. We need the time to make sure everyone meets the criteria and is prepared to produce the kind of volume we need. We are going to pay special attention to the small restaurants in our diverse neighborhoods of Sacramento. We know that most of the restaurants are in the central city, And of course, people like Patrick Mulvaney continue to amaze and lead, and they're going to be the leaders for this program as well. But we're going to be intentional about ensuring that those small places that are some of the coolest places in Sacramento with some of the best food are participating. Because we've learned, the first round of $1 million funding for small businesses, there were some concerns that maybe it did not go wide enough in terms of reflecting the diversity of our neighborhoods and communities. We get it. We're going to try to make this program even better. Finally, I want to talk about Donate for Sacramento, because that is another source of funding beyond the city funding that we are using as a community to try to help as many businesses and people as we can. Thank you again to Chet Hewitt and the Sierra Health Foundation, my colleague Jay Chenier, and all of the participant organizations. It's the United Way that has distributed $500 grants to almost 500 families to help fill in the gap here. That's a big deal. It's the Sac Asian Chamber that is provided or in the process of providing almost 120 grants of $1,000 to small businesses, again, in our diverse neighborhoods, mostly minority-owned businesses, to help them deal with what they're going through. It's Sacramento Steps Forward that has worked with Loaves and Fishes to provide 200 meals a day to people who are on the streets. It's the Region Foundation that has been providing small grants to some of our arts organizations and our other nonprofits. And of course, it's the Sierra Health Foundation that has distributed money again to our food bank and to Sacramento Act and so many other important and worthy organizations. But here's the deal, as they say. We raised 1.2 million. We spent a little over $1 million. And so we're running out of money. And we want to do more because this isn't over. So if you can go to Donate for Sacramento, and that's a number 4.org, and make a generous contribution, you will help people you may never meet, and who may not know you, but in their heart and your heart, they will deeply appreciate anything that you can do. And there are going to be a couple fundraisers to raise money for this, including Capital Road Race Management is organizing which organizes Run to Feed the Hungry, is planning 3 shelter-in-place virtual races over the next 3 months. So I don't know what that means, but I guess it'll be a race where you're in your, where you're in your home and you're running in place, and everybody comes in first, and that's the main thing. I'm going to save the mental health conversation until the next time, because I provided you with a lot of information here tonight. Once again, Sacramento makes me proud every day, because there are people who don't look for credit, don't look for a pat on the back. They only ask, what can I do to help? And this is not over yet, but it will be. And we will resume our lives. We will restore that momentum that we feel every day in the city we love. We will continue to build the city that we want, that is inclusive, that speaks to the best of human values. And in the meantime, let's all just hang tough, hang in there. Every day and every week now, there's going to be some loosening here, some improvement in terms of a return. But let's stay the course so that we can get back more things sooner rather than later. Thank you very much for watching or listening tonight. I wish everybody health and safety. Appreciate your support. Good night.